Hi, everyone. My name is Gavin Luter. I'm joined by my colleague, Elizabeth Berg, who's a grad student. She'll introduce herself in a second, but we're here to talk about a project on climate change, heat, and health in Madison and Milwaukee. So first of all, how did we get here? What is the University Alliance? We're essentially a network of people on campus who care about making UW-Madison's resources accessible to local governments who want to tap into them. One of the things that we do is that we host a speaker series. We found out about a guy named Dr. Larry Kalkstein's work on connecting climate change and health and heat. And we thought, let's invite him to a speaker series. And while he's in town, he will meet with people from Madison and Dane County to say, what are you doing with climate change and heat and health? And then that one meeting turned into 1 year later, we have a group of network stakeholders that include the city of Madison, Dane County, Milwaukee, the Milwaukee Sewerage District. I've mentioned applied climatologists in Dr. Larry Kalkstein's lab, Chris Kucharik's lab in agronomy, the Nelson Institute, the Wisconsin Initiative on Climate Change Impacts, even the Wisconsin Department of Health Services, to answer some really interesting research questions that Elizabeth is going to talk about right now. So Elizabeth, take it away.
Hi, everyone. I'm Elizabeth. I'm a grad student in the Nelson Institute, and I've been working more on the analysis side of this project. So our work has involved synthesizing data from multiple sources. For both cities, we incorporated daily synoptic classifications, which are a system that was developed by Dr. Larry Kalkstein and his colleagues to categorize each day into a finite list of weather categories using a full set of meteorological variables. The most common classifications are included in the table on the right, and the two classes that we're most concerned about for human health are highlighted in red. These two most oppressive air masses are the dry tropical and moist tropical plus, which represent the hottest and driest days, and then the hottest and most humid ones. In addition to these classifications, we also used meteorological data from the weather stations at both cities' airports and daily all-cause mortality. The first piece of our analysis involved using these synoptic classifications and the meteorological data to explore historic trends in the frequency and characteristics of summer air masses. From there, we turned our attention to the mortality data, which we standardized to remove demographic trends and any other non-meteorological factors. Finally, we analyzed all three data sets together to identify and quantify any linkages between mortality and synoptic conditions. On the next slide, I'll show you some of the figures and results from our work. So the analysis of recent trends in summer air masses has shown that some of the most oppressive conditions are also becoming more frequent, often at the expense of the most cool and comfortable days. So the four plots on the left are all showing Milwaukee data, but the Madison trends are quite similar. These figures show that since 1948, the number of summertime hot and humid days has increased at a statistically significant rate, while the most comfortable dry and cool days are becoming less frequent. Analysis of our standardized mortality data on the right further shows that in addition to becoming more common, oppressive weather conditions are showing clear linkages to elevated mortality. So in Milwaukee, for example, hot and dry days average 2.7 more deaths than the typical day. Both cities also show elevated mortality on hot and humid days, represented by MT and MT+, and then decreased mortality on the summer days that are coolest, represented by the DP and MP designations. So on our next slide, we'll just talk a bit about the next steps. Now that we have established a relationship between weather conditions and mortality, the next step is to quantify this relationship. We're working to develop algorithms to predict the likelihood of increased mortality from synoptic data. From there, we're hoping to revise the state heat health warning system, possibly in collaboration with NOAA and the National Weather Service, to develop a heat warning system that's more explicitly tied to adverse health outcomes.
Yeah, and then we also have a stakeholder meeting planned in Madison to talk about these data and the outcomes that we have and how we can move forward into figuring out how to work this into plans, into city and county plans for a broad climate change strategy. So yes, we have a meeting planned for May 12th at 4 p.m. If anybody is particularly interested in joining us, let us know. We have a registration link, but we're inviting department heads from the city and the county. We're inviting alder people, board members from the county board, and essentially any major stakeholders who are interested. So like I said, you're very welcome to join. With that, this is our contact information. If anybody wants more information about the general initiative, let me know, or about any of the research, you can certainly let Elizabeth know. And we're very, very appreciative of your time. Thank you very much.